Welcome back to Taiwan Outlook. We've been talking about Taiwan's national health insurance system. Joining us today is Professor欣仪from Lehigh University. Professor Zhou, as we know that obesity has been one of the major sources of many diseases. But as we know that our kids, younger people, even children, are having problems with obesity. How do you explain that kind of increasing problems we are facing right now?
There are many possibilities. A lot of people say that it could be genetics. But according to research, genetics shouldn't be the reason because our genes did not change a lot in the past, decades. The most basic reason to explain why people get fat is that you have much more calorie intake than calorie expense. So people eat more and more food and more fat food. And exercise less, right? So for kids, they spend a lot of time watching television. They spend a lot of time playing the video games. And because of the competition, they need to spend more time in the classroom. Schools are cutting the physical exercise, physical education, right? So those are the possible reasons. And according to our research, fast food restaurant, the growth of fast food restaurant is the most important factor to explain the trend of obesity in the past decade in the United States. United States is probably the country facing that has the most serious obesity problem. Now, obesity becomes the epidemic problem, in the world, but United States is the country that has the most serious problem. Currently, 70% of the population are classified as overweight in the United States, and 30% are classified as obese. So our research suggests that the growth of fast food restaurants is the leading contributor to the growth of obesity. And our results do not suggest that we should blame McDonald's, we should blame, Kentucky Fried Chicken. If we sit back and think about the story behind this trend, you will notice that people become busier and busier, right? And another thing is that women, the woman labor force participation becomes higher and higher. A lot of women, they participate in the labor market. They work. They don't have time to cook. So we, because the value of time, we rely on those convenient food more and more. And those fast food tend to be caloric rich. So, as a result, we take a lot of caloric rich food, but we spend less time exercising, and we did not spend.
Has the obesity become one of the major burdens for the health insurance system for many countries?
Yes, especially in the United States. Obesity is the third leading cause of premature deaths in the United States, next to cigarette and alcohol.
Really?
So each year, the government has each year we spend a lot of money treating obesity-related diseases, such as heart disease, those obesity-related diseases. So we do spend a lot of money treating obesity in the United States, to spend a lot of money treating the obesity-related diseases, right? And recently they begin to think that to cover obesity treatment costs under Medicare, right? So it's going to be a huge burden.
But are there any other problems to prevent the obesity problem from further deteriorating?
That is something we discuss, especially for kids. A lot of kids are obese as well. Like, probably 30% of the kids are classified as obese. So this is why more and more kids are suffer type 2 diabetes, due to their body weight. So now there has been a lot of discussions about various proposals, you know, how to cope with this problem, you know, like encourage the physical education for kids, encourage physical education, you know, provided by schools, banning all the vending machine, you know, in
campus.
In the campus, and a lot of people also talk about, you know, the fast food restaurant, the advertising, you know, on television, on computer, on video games, you know, things like that, because kids spend a lot of time watching television.
Let's talk about TV commercials. You know, as you know, that kids spend too much time watching television. So the TV commercials could be very influential in influencing kids, you know, eating habits. So is there any restrictions or any policies regulating this kind of TV commercials in the States?
Actually, in several now developed countries in Europe, like Finland, Norway, Iceland, Sweden, they completely banned commercial sponsorship from children's program. So there's no commercial during the children's program in those European countries. But in the United States, you know, it's very hard to completely ban the commercial sponsorship from children's program. So kids will still, you know, see McDonald's commercial advertising on television. And kids are, you know, easily influenced by those, you know, cute characters, you know, fancy toys, right? So, I mean, those commercials indeed have a lot of influence on kids. I think Taiwan also, you know, will have this kind of problem in the future because more and more moms participate in the labor market. They have to work. They don't have time to take care of their kids. They don't have time to spend. They don't have time to pay attention to their nutrition, to their exercise. And the kids tend to spend a lot of time watching television. So what I do think that is something we need to think. You know, a lot of kids right now are taken care of by the, you know, foreign laborers. So I do think that we probably need to, you know, the government probably need to think about that too.
That's right.
Right.
In terms of children's behavior in schools, and I think the education is very important in terms of changing children's knowledge or improving their knowledge about the obesity problems.
Right.
And how do other countries, especially the States, do to raise the awareness of the kids' information about these kind of obesity problems?
Yes, through education is probably the most important way to cope this problem, because exercise, eating, drinking, smoking are really, you know, personal choice. The government, a lot of people say that, you know, I want to smoke. Why should I stop? Those are, you know, individual choices, individual behaviors. The government should not intervene, but the government will only intervene if your behaviors create negative externality. In other words, if your behaviors impose cost on others, then we probably need government intervention. For example, if you smoke, you know, people will have secondhand smoking, you know, if they are around you. If you drink and drive, you know, the probability, you will increase the car accident, the probability of a car accident which will involve other people. Obesity, you know, it is probably hard to think about negative externality, you know, resulting from the obesity.
And that will increase the cost of insurance, health insurance.
It will increase. Yeah, that's a very important factor. But if no, you can think about many other examples. You know, we pay more on flight, on fare, on airplane fares. Yeah, more and more. The cost of airplane fare is higher and higher, and that is because the weight, you know, is heavier. So the airplane, you know, the company, they have to raise the fare.
That has been very controversial because people say that it's a discrimination against fat people. Do you think that that's a sound argument?
Yeah, but again, no, because of the negative. So if from the economics perspective, you know, if you generate negative externality, then if you impose the cost borne by other people, then we probably need the government intervention. It's not discrimination. So government, like in the past 10 years, the U.S. government increased the tax on cigarettes. They increased the tax on alcohol. You know, the purpose is just to create incentive for those people, you know, to do something to lower the cost borne by other people, right? So, you know, similarly, we can use the same logic to think about the problems of obesity. Now, if you create a cost borne by other people, you increase the health premium, insurance premium by other people's, then the government need to do something, you know, to correct, you know, this, you know, personal choice.
But if we take the argument to the extreme, there are also other problems that could create some kind of externalities.
Yeah, then the government, we probably need the government intervention, you know, to do something, increase the tax or, you know, do something, right? So, you know, in U.S., people keep talking about like increase the tax on fast food, increase the tax on McDonald's, you know, and give some subsidy to fruit, give some subsidy to if you purchase vegetable, you know, things like that. And they also talk about, you know, give subsidy to those employers who offer, you know, who offer facility or encourage their employees to do some exercise, to take breaks, to do some exercise. Give some subsidies to those people, you know, to those employers who encourage their employees to do something, right? So
coming back to our problem on the national health insurance system in Taiwan, you know, we've been talking about the copay by the individuals.
Right.
How about the company's share? Or the you know entrepreneurs' share of this insurance premiums, because some people argue, especially for the owners of the companies, they think that it increased the cost for their companies, and that makes them more or less competitive in the world market. Do you think that's something that we should think about in the future?
You know, to be honest, comparing with the premium paid by the employers in the United States, I don't think our employers pay
too much.
That much, yes, okay. Pay that much, and I think we need to understand that if you have very healthy employees, they will increase your productivity. So it's very important to provide health insurance, to support the health insurance for your employees, to protect your employees. So personally, I don't think employers should feel that it's a burden. No, they should. I mean, they should be happy that they do not share the whole cost.
Yeah.
Right. Like in the United States, 60% of the population are covered under employer-provided health insurance, and actually employers pay a huge percentage of the health insurance premiums. Right.
Yeah. But another part of the insurance is covered by the government.
Right.
And the government has been facing difficulties in paying the fees and premiums and so on. So one way to solve the problem is to raise the tax. So do you think that's a right time to do that in Taiwan?
Probably not.
Yeah.
Yeah.
But the thing is, in the long run, you cannot just maintain the system without raising the tax, right?
Right. So, well, I don't know. So this is something the government need to think. Global budgeting might be a way to do it, but how to implement this global budgeting, is complicated. It's very complicated because you want to give hospitals enough incentive to provide good care to the people, right? So, again, maybe we should do something on the copay. Copay on hospital care, copay on prescription drug, copay on dental care, dental services. Right?
In terms of medical service, on one hand you can market over there, but on the other hand you also have the government intervention and so on. How can we balance in order to make the health insurance system more balanced and more approachable or accessible to the people?
It's hard. Not only in Taiwan, in many other countries, healthcare market, healthcare system is probably the most regulated industry now, not only in Taiwan, but in the United States, because, we all need healthcare at some point, and the outcome of the healthcare, is vital, right?
Yeah.
Sometimes it's life and death.
Yeah.
So this is why the government needs to have. This is why this market is heavily regulated by the government, not only in Taiwan but also in the United States. So I think it's not avoidable, you know, to.
But comparing with other countries, do you think that the market is over-regulated by the government here in Taiwan, or should be, relax the restriction on regulations?
I think we are probably about right. Right.
So in the long run, I think the system should be okay, right? Unlike other people's pessimistic views, in the long run, it should be okay.
I'm optimistic. I think we should be okay. But again, how to balance the cost and the quality, is very important, because it's very like that. Everyone has we still have national health insurance, but maybe at the end we have to pay everything. I don't know.
Yeah.
The copay is so high that we have to pay everything by ourselves. The out-of-pocket expenditure is so high.
That's right.
It's possible, right? So how to balance is
good.
Very important.
Yeah, Professor, thank you very much for coming to our program.
Yeah, thank you. It's my pleasure.
And Professor欣仪from Lehigh University. And thank you for watching Taiwan Outlook, and see you next week.